I was raised in a part of the world where I was told that I'm less worthy as a human. And so maybe that's philosophically why I've decided that I'm going to prove that wrong. It might only be very small, in a very small way, but that gives me purpose and it gives me meaning. I've grown up in a part of the world where there is lots of inequity, and I have I'll thank my mum and dad for the strong sense of justice that I developed, and decided that this is something that I want to dedicate a lot of my life to be able to serve people who deserve to have good care and excellent medical care wherever they lived, regardless of their postcode. People underestimate you when they see you as the ethnic person in the room. But wow, this person can speak publicly and speak strongly and really be passionate about something. It's good that people underestimate me because it means that the bar is very low and I can do more than they think or predict I can do. When I was going through my training, and we had a doctor who had trained overseas that I was working alongside, and we were just talking about, some of the racism that they encounter day to day. And there was one time, a patient had made a comment about another doctor. So a comment about, it's lucky that that doctor can practice here. I can't even understand them. And I said, that the reason you can't understand them is actually because...
Hi, Marian. Welcome to Perth Dialogues. And thank you for making the time. You're a busy, busy doctor.
Thank you so much for having me. It's an honor. I feel very, very lucky that you found me.
Actually, it was a very interesting point when I found you. I did an earlier podcast with Alicia on the bypass that happens in the maternity settings across Australia, especially in regional and rural Australia. And that was such an eye-opening podcast and conversation that I had with her. And I think through that conversation, I found you and the work that you do, and that's what I thought, like, maybe this is another great woman that I need to bring on if I can. So here we are.
Alicia Staines is a very big inspiration for me. She's done some amazing advocacy and work in this space, and we're very grateful for the things that she's been able to achieve. So I'm lucky to take her on the journey that I've started as well.
So I know you as a doctor working in a regional area, and you work in that sphere of ONG. That's what I know. But how would you tell the listeners and the viewers about yourself?
It's hard to know where to start. So I was part of a family that migrated from Egypt, where there's a lot of religious persecution, sort of some things that are ongoing to this day. We're part of the religious minority in Egypt. And it was probably in high school that I decided that I wanted to do medicine. I didn't get in straight away. I did the HSC, got a mark that was decent, but not good enough for medicine. So I did a science degree, and maybe a little bit of teenage rebellion. I wanted to move out of home as soon as I finished high school, and got a scholarship for a regional centre that was doing science degrees up there, almost a bit of a pre-medicine step. And when I moved to Orange, New South Wales, which is the regional centre, I just fell in love with the country. I hadn't realised how much of an inequity there is between rural and urban Australia. And I learned about, just the beauty of the people that are there, people who are very grateful to get medical care. They don't have the same access, that experience a lot of inequities in their health outcomes. They present much later with more advanced pathology. And so it's very interesting medicine, but it's also, something that striked a chord with me. I've grown up in a part of the world where there is lots of inequity, and I have I'll thank my mum and dad for the strong sense of justice that I developed, and decided that this is something that I want to dedicate a lot of my life to be able to serve people who deserve to have good care and excellent medical care wherever they lived, regardless of their postcode.
So I came to Australia as as an adult, and on straight as a permanent resident. And I will never understand what your migration story is as a child. coming from facing religious persecution. So, what do you remember from those days? Can you tell us something about that?
I just remember a lot of, things that happened that I came to believe that the governments and the systems and the structures in the countries that are overseas perhaps don't value human life or don't value people equally based on, what they're born into. So, being judged as someone, you are from the religious minority. So automatically we have to pay extra taxes and, we don't get the same opportunities in our careers. So I can understand why my parents made the decision to find somewhere where their children can have a better future. But I think it was just arriving in Australia and seeing the juxtaposition, just seeing the differences. That's probably what highlighted to me the things that I took from my childhood. So I came to Australia and there is literally a button that you can press that tells you when it's safe to cross the road. There are garbage trucks that come to collect the rubbish from every street. Just those things. I remember coming to Australia and thinking, this government must really care about its people. And that for me is something that I will continue to be really grateful for. I hope that I never take for granted how lucky we are to be here.
Yeah, I've heard those stories when people actually look at their watch and say, "Ah, the bus has appeared." And especially my wife told me when she saw, like, you've seen the traffic in India, and she saw the traffic working driving in a lane, giving all the indicators and then moving to merge. And she said, like, this is almost like clockwork. It's not people driving, it's clockwork where machinery is moving in a sense. So this is actually something very peculiar and so advanced that we take it for granted, you know.
Exactly, exactly. I think, it's important to continue to reflect on these things. There's exercises that counselors will come up with and say, think about things that you're grateful for. For me, it's constant. There's frustrations that I have at work or frustrations that I have with human behaviors, but I will never forget how it felt being a child and seeing people that are begging for healthcare, things that we take for granted and don't realize how lucky we are. It's such a contrast, and I'm really glad that I went through what I did.
Now that you are a parent as well, how do you see the sacrifices that your own parent made when they thought of moving from Egypt to Australia, and they had to actually carry the whole family? Because I never did that. I said, let me go there, let me check, let me settle down first, and then I'll bring the family in. Your family had to move in one shot. How do you see that now?
I think from a young age, I think I got a little bit of a sense of how much hardship they experienced. I could see that, mum and dad didn't have much English when they arrived. For me, it was easy. I was only 8 or 9 years old, so I picked up English within a month. But mum and dad are continuing to sort of learn the language and how the system works here. I remember being a child and, helping them with Centrelink forms from a very young age. And so filling out forms was something that I, saw as part of my service as a child to these parents who'd given me such great opportunities. And I could see that, moving away from your family, moving away from your supports, being very successful in your home country and then coming here and having to start almost from nothing. I have so much respect and admiration for them. And I know that they've passed on to me their work ethic. And these are things that, what mum and dad have done for us, I would never be able to repay what they've done. It's something that I feel very lucky for.
And what you saw as a child and as a teenager, how does that affect you when you're working today as a specialist GP? You are there somewhere.
I think in some ways I find that I can identify with patients that I meet who, might have English as their second language or might be Indigenous. I identify as Indigenous to my own country. And so the themes of talking about how colonialism has affected their healthcare, the themes of, multi-generational trauma, being able to work out how someone's social determinants have influenced their health. These are things that I find almost sort of intuitive. I get those things. And so for me, it makes it easier for me to be able to relate to those patients. And I hope that that enhances the care that I give to them. But I remember even, even as a young person going through high school and my family going through their own health conditions and being the person who's able to sort of translate things, but in a way that not just an interpreter can do, but someone who goes, I know what's important to mum and dad. I know culturally what might be really difficult. This is, something that's quite a sensitive examination or a sensitive test that they need to do. And so I understand the context really well. And I hope that, to this day, this is something that's going to enhance the care that I'm able to provide. And I sometimes wonder if in medicine, we're providing opportunities for people who perhaps are not in those sort of ostracized backgrounds. I wonder if, medicine as a profession should be more welcoming and inclusive of people who don't identify as, having a privileged upbringing, someone who's, neurodiverse, someone who, has different ideals, different perspectives on the world, because as many opinions as there are that you meet with your patients, there's probably even more so from a clinician perspective. And we need to diversify the type of person that we allow into medicine.
So, with that context, every time you go into a hospital or even your clinic or in any health settings, do you think you have to, perform at a higher benchmark than other, maybe Australian doctors, like who were born and brought up here?
In some ways, yes. I think, there's times when I've had to prove my worth or prove, my almost my ability compared to people who perhaps have been born in Australia, have had a more privileged upbringing, have had parents who practice medicine, or, people who've had generations of, I'm a fourth generation doctor and I know that I'm going to be a cardiothoracic surgeon, for example, or someone who, I didn't come from the country and sometimes I had to almost prove that my dedication to rural Australia is true, even though I'm someone who's come from another country. So yes, I think in some ways I have had to um, perform at a different level to prove that. But I'm also unapologetic for my background and my abilities. It's not something that I'm going to be ashamed of. I'm very proud that I'm someone who went to a public school, very proud that I'm someone who doesn't doesn't have anyone else in the family who was a doctor before I became one. Very proud that English is not my first language. These are things that I celebrate, and I think I will continue to be proud of those things and encourage others who are from other backgrounds to show them that you deserve to be there just as much as anyone else.
There is, and I've worked with migrant communities in my earlier role, and I saw that while we invite a lot of doctors and health professionals from foreign lands to come to work in Australia, but since the point they come to Australia, it's so hard to get into actually start working. There's hoops and hoops of tests and accreditations and APRA registrations and this thing and that thing. Why do you think that is, and why do we make it so hard for people to even actually start working and then they have to perform at a higher level, the migrant doctors?
It is honestly a huge injustice, I think, in our profession and in many professions. I don't think medicine is the only one. I think in some ways there is, that fear of the unknown, and that continues to this day. I think it's almost, a crime to be able to make people go through more difficult hurdles than someone who is locally born. It's not fair. And I remember when I was going through my training and we had um, a doctor who had trained overseas that I was working alongside. And we were just talking about, some of the racism that they encounter day to day. And there was one time, a patient had made a comment about another doctor. So a comment about, it's lucky that that doctor can practice here. I can't even understand them. And I said, you know that the reason you can't understand them is actually because they're 5 times better than I am. Then not only can they practice medicine in English, they can practice it in 3 other languages. They're actually 5 times the doctor that I am. And I remember people just stopped and, had a second thought about what they just said. Oh, I didn't mean that, lots of backtracking after that. And I think there does need to be a bit of a respect for what people have been able to accomplish, even if it's not in a country that we understand or know, because in many ways they've actually jumped through hurdles we can't imagine and much bigger ones than we have, and they deserve the respect that we don't give them.
So you started your life, or as a small kid, as a migrant. You came to Australia, you settled down, you became a doctor, and then you started on another migration journey to regional WA.
I did.
How did that happen? Like, why would you choose to go there, that path?
It's ironic. I think, my parents managed to migrate from Egypt to a large city in New South Wales. Why can't I migrate to, remote Australia? Because I'm in one of the most remote towns you can work in as a doctor. I have worked in a place where the tyranny of distance and the geography that we live in is a big part of my specialty. So, there's numbers that are etched into my brain. I'm 827 kilometers from Darwin. I'm over 1,000 kilometers from Broome. Just distances, like all of our aeromedical retrievals have to be done by air. Like they can't be done by road because of the distances. And that adds a challenge that really excites me. And it's something I feel very privileged to be part of, because I can look after patients even if I know retrieval is hours away. I can continue to hold the fort and I don't send things out quickly. So we are people who, as rural generalists, we are specialists in that distance. And I think, the courage that my parents have had to be able to migrate from Egypt down to Sydney, why can't I? This is my way of saying thank you to mum and dad, because they've had the bravery to be able to say, you can become whatever you want to become. I've come here to Australia to give my children opportunity so you can live. And that is what I'm doing. I am living to the fullest that I can.
But there would have been people, right, who would have said, this is madness. Your father would have said that. Possibly, if you were married, your husband would have said that. Maybe your children would have said that. How did you convince everyone to do that? Especially because you're a female. Like, Australia might be different, that it's easy to move around, but there's still those challenges as a female rather than a male doctor. How did you manage that conversation?
I honestly think I enjoy breaking stereotypes. That has been the theme of my life. So no, I'm not going to stay home and be the mother. I am going to go back to work 2 weeks after having my children. No, I'm not going to choose a family-friendly career. I'm going to be a rural generalist who does surgery and does more on-call than most other specialties. No, I'm not going to be, the white male that is typically a doctor. I'm a very small ethnic female who can command a room of politicians and leaders. And that's something that I really enjoy seeing. People underestimate you when they see you as the ethnic person in the room. But wow, this person can speak publicly and speak strongly and really be passionate about something. And I enjoy just seeing, the surprise sometimes. It's good that people underestimate me, because it means that the bar is very low and I can do more than they think or predict I can do. But to convince people, I think is a big skill to have. Once I was told, someone asked me, what is the quality of a good leader? And in some ways, we think of leaders who will stomp their feet a bit like Trump and, this is what needs to happen and this is what I say needs to happen. Being someone who's, an ethnic female perhaps doesn't demand as much authority with my physical presence. I have found better ways to influence people. I will influence people with my behavior, with my beliefs, with things that they identify with. And as a leader even in a team in a hospital, I'm the gentle one who will actually see what people's strengths are and play to the values that they have. That is how a leader works. A leader is not someone who forces things. A leader is someone who can influence and build their team.
So, as a female professional who has done that, and you have built that mental model for yourself, what suggestion or advice you will give to a budding professional, female professional, how they should think about these things when they are faced with these kind of challenges?
You have to almost approach with more humility. I think in some ways, people come into these environments and they think to command authority, I need to have a strong presence and I need to really force my perspective so that people will listen. But actually, when I started off, I did lots more listening than I did talking. I need to understand what the issues are. I need to research the places that I want to be part of. So I learned about, what are the issues that people in the country find? Like what is it that you need when you present to a hospital? Why is it that you present later? Why is it that your farm has such an importance in your life that you can't come until you're on death's door? Why is it that this medication isn't something that you were prepared to start even though we'd spoken about it? That's how you're going to create impact. If you start to understand what it is that motivates the person that's in front of you, you will have more impact. And so take the time to listen, have some humility, listen, because that's how you're going to be able to influence. And I think the other tip that I have is don't feel that your opinion is less valuable than someone else's. Yes, I come from a different background. Yes, I wasn't, someone who was born and bred in rural Australia. Yes, I'm someone who, English isn't my first language, all of those things. Yes, I'm a woman and I've got children, but that doesn't mean that my perspective is less valuable. My perspective is actually one that needs to be heard, and I need to have a voice at the table. But I'll understand the issues before I stand up and start to make suggestions. I'm a guest on this country. This isn't the country that I was born, but I'm a guest and I do want to help. So let me listen, let me understand the issues, but I'm not going to stay quiet if I see something that needs to change.
So, when you moved to Kununurra or Kimberley, it's already so hard to find a job for your spouse and a childcare for your children in Perth. How did you manage that part in that rural area? Because I've had a whole podcast on childcare where people said there's nothing. Only the family is looking after each other. How did you manage?
Look, to be honest, I think, there's some misconceptions. There's, if a town values a profession, so let's say we need to have more police officers or we need to have more teachers here, I challenge the community and ask them, what are you doing to support them? What infrastructure have you created? And actually, when I moved, the first rural place that we moved to after I graduated was actually as a final year medical student. I hadn't even graduated then. I was pregnant at the time, and it was Lithgow in the Blue Mountains in New South Wales. And almost as soon as we arrived, our neighbours came to introduce themselves and offered to look after the baby that was still in utero. And I remember thinking, there's no way this would have happened in Sydney. If I was in Sydney, like I hadn't spoken to my neighbours in years. Like you're anonymous. A lot of the transactions we had were so time pressured, and you can continue to live your life and nobody knows who their neighbours are. But in the country, it's much more personal. And I do challenge the communities and ask them, what are your community members doing? If you do want more teachers and more doctors and more physiotherapists and all of those sorts of things, what infrastructure have you made to make a welcoming place for them and one where they can make life work? I have to say I've been very lucky. I have a partner who's decided that he is more than happy to take on the parenting role. And so I can't answer this question without giving him due thanks for what he's done, because he's sacrificed a lot and he's been an incredible father to our children. And I couldn't have done, 3/4 of what I've done without what he's done. And I think he's actually taken on the bigger role, being able to look after the kids while I chase these crazy dreams of mine.
So, now that you are here, you've managed your kids, you've put your husband to work to look after the kids. How does a day look like in your life now? Like, give us an indication of what happens in your whole day today.
Every day is very different, and it's one of the reasons I've chosen this specialty, because if I had to do the same thing every day, I wouldn't have lasted very long. So on a typical week, there's, 2 or 3 days that I would be on call for obstetrics, and, they're the best calls that I can receive. If someone's in labor and I need to go in, or, someone's come in and they've had some bleeding, or they're worried that their baby's not moving well or anything like that, I love that I've been able to have the skills to be able to provide the support and the care that they need. I also work in different parts of the hospital. So I do some primary care, some GP work where they send us out to the remote communities, and we see anyone who comes in. As soon as they hear the plane coming over, they know that the doctor's in town and they'll come and see us if they need to. We also work in the emergency department. I also, will go to theatre if I need to. I will look after patients that have been admitted. So, if someone has pneumonia, or they're not coping well at home, they'll be admitted to our ward. And I've got this incredible multidisciplinary team that works around us. And it's a very rewarding role. I love the variety that I have, and I love being able to do lots of different things as a rural generalist. There's very few sort of subspecialties that will survive in a country town. I think what the town needs is someone who does have that diversity. We call it a Swiss Army knife of skills. So if someone walks through the door and they've got chest pain, if someone walks through the door and they've got a child who's got, they're having trouble breathing, if someone walks through the door and they're bleeding from something, they are all things that I can manage. And that's the Swiss Army knife that a country town needs. So there is no typical day. There is no one day that looks the same as the other. It's all varied, and I love that.
You talked about being in obstetrics. I'm always mispronounce that word. It's so confusing. Even though I wanted to be an ONG specialist when I was a small kid. Uh, and, these challenges are there. And I did a whole podcast with Alicia Staines on when she talks about the rural and regional hospitals frequently going on bypass. We see from a consumer point of view that this hospital has gone on a bypass and now the mother has to go somewhere. From your side, what's actually going on behind the scenes? Why the hospitals are going on bypass so frequently?
Unfortunately, obstetrics has become a specialty that has become one that's feared by doctors. There's a lot of trainees who are avoiding obstetrics, and I think, the litigation that comes with something that is so precious, that the stakes are so high in obstetrics. We are quite vulnerable as clinicians. I think, it's important to counteract that by saying, I'm someone who's gone into this because I care so much about women's health. Yes, it's a great specialty because I'm able to use surgical skills as well as some internal medicine skills, and I'm able to sort of utilize good communication, trauma-informed care, being able to meet a woman or a birthing parent where they're at, and to make sure that we empower them. We're being called to a higher standard from our consumers, and that's something that I think has been a really positive change in the last 20 years. It used to be that, you go to the doctor when you're pregnant and you do what the doctor says. That's not the case anymore, and I'm so glad that it's not the case anymore, because now you go to the doctor, they will provide you information, but they're not going to tell you what to do. And I love that women are so empowered. They come in with knowledge, and they come in with what they envision. And it's my job to offer them what is going to be safest and to explain to them why that is. Because it's not me who's going to predict what's going to happen. We actually make the decisions together. And so I do think that one of the biggest challenges we're facing is that our specialty has become so feared. And I hope that with time, we can partner with our consumers and partner with our patients more, and really lean into making sure that we empower them so that they are satisfied with their care. I so want women to feel that they are happy with their birthing experience. That to me is just the pinnacle. It might be that, let's say you end up with a cesarean section, or you end up with a big bleed, or you end up with a baby who's needed a bit of support and had to stay in hospital longer. But if you feel heard and you know that the team has supported you as best they can and they've utilized all of the resources that they have because they care, that to me is a win. And I want people to know that. And I hope that the next generation of doctors, the more that we can connect them and help to debrief when things go unexpectedly and make sure that they have mentors, the more that we're going to make sure that people don't fear our specialty because it's such a needed one.
You talked about, empowering the woman during that whole process of pregnancy and childbirth. There was recently this case in Victoria where I think the court in Victoria, I think the Supreme Court in Victoria said that the mother was forced to go through those vaginal examinations and without her consent. So can you walk through us what happened there, and like how does that affect the mother, the other mothers who listen to that story, and also the health professionals, and how does that affect that whole relationship?
It's a really groundbreaking case. So you're referring to the case in Bendigo of Gawthrop. So what had happened, or what was documented, is that, this woman had had a continuity midwife, one that she knows. And when she came into labor, really wanted that continuity midwife to be called in, and she wanted to have some options for pain relief. Unfortunately, it was hospital policy that they do an examination to see if the woman was in labor. And I can understand from the health service perspective that policy was in place because they are bed pressured. So if someone isn't quite in labor yet, sometimes you have pain, but the labor hasn't actually started. We need to be a little bit judicious of who can come to the labor ward and who needs to stay home for a little bit longer. But I argue that there is a way to work out if somebody is in labor or if somebody needs support and needs that bed, regardless of how many centimeters she was from the vaginal examination. You actually will find, and it's really interesting to understand this woman actually went on to have several vaginal examinations and a vacuum delivery. So it wasn't that she was being unreasonable. She was actually very reasonable, and she knew that every step of the way there are things that needed to happen to make sure that her and her baby were safe and could go home safely and well at the end of the day. But it was the dynamics. It was what had happened initially that she was absolutely coerced into that vaginal examination, and that is assault. That is assault and battery, and it shouldn't have happened. I think it's important for clinicians to understand that regardless of what hospital policy is, if someone says no, it means no. Even if someone says yes and they change their mind and say no, we need to understand that is basic principles of consent. That shouldn't have happened. She should have been heard. If she doesn't want a vaginal examination, she deserves that bed because she needs pain relief. We should give her pain relief, and we should call in her continuity midwife and see what will empower her to make sure that she is safe. Someone decided that it was more appropriate to follow hospital policy, and I can understand that fear because we are so risk averse and we don't want to be sued and found to have gone against policy. But our policies need to change. Our policies need to center the woman, center the birthing parent, not our processes.
So, we have our policies around this care and, informed care, and then this court ruling comes in. What do you think we can actually change, and what things will not change and they will remain because they have been there for another set of reasons?
There's a few things that need to be in place so that we can make a system that's a little bit more empowering to the patient. I think at any time that a hospital or a health service creates a policy, they need to include the voices of the consumers. When I started the not-for-profit organisation for rural maternity care, I made sure that there was a strong consumer voice there because there should never be a decision about a consumer without a consumer. I also think it's actually really important for us as clinicians to reflect on the evidence behind any of the practices that we have, there is so much in maternity care, in medicine in general, that's not actually evidence-based. There's things that we do because it's what has been done for many years, not because there is evidence that it changes the outcomes for good. And that's something that we need to continue to reflect on. Is what I am offering actually evidence-based, or is it just what I've been taught because other people are doing it? And when a woman comes and asks, is it okay that we don't do any vaginal examinations, for example, or is it okay if we stop monitoring my baby the way that you're monitoring? I need to make sure that I reflect on the advice that I give them to say, you are in control of what happens. Having this intervention may improve some outcomes, but I need to make sure that there's evidence for them. If there isn't, I'm not going to counsel them to say this is super important. That's something that I think our profession needs to work on. So A, making sure that there is a strong consumer voice whenever we create a policy or a guideline, and B, that we reflect on the actual level of evidence for the things that we do.
I was looking at the statistics, and there's another thing I found that since 1990, the number of maternity beds has been like almost halved since then, but the number of birth has doubled. So the gap is almost like 4 times now. Do you think we can solve this, or we have to find some other solution instead of investing in infrastructure?
That's a really complex question. But yes, the number of rural maternity units have halved. We've lost almost 50% of our rural maternity units. There isn't actually lots of good data to actually tell us what the numbers are, but there has been an ideology, and we call it geographical narcissism. There is an ideology that women will receive better care if we centralize services and make them all travel to the bigger hospitals where they've got all of the fancy machines and all of the subspecialists, because otherwise it's not safe to birth. We have to continue to challenge that and remind people that when a woman has to travel in labor, every time I refer to a woman, not this gender neutral, it could be someone who doesn't identify as a woman, but anytime that we ask of them to have to travel hundreds of kilometers when they are in one of the most vulnerable states that you can be as a human, that is society letting them down. That is a society that's no longer functioning as it should. And I will continue to fight for that. I think, as part of our, human rights, we should be advocating for our mothers and our children. They are the most vulnerable in our society. And if we're not looking after them, we don't have a society. I think that there needs to be a few things to try and contribute to that. We need to make sure that our administrators are on board. We need to make sure that our consumers are heard. And we need to make doctors less afraid of the specialty and partner with patients so that we're delivering care that is evidence-based and that is woman-centered. But that's going to take a lot of work. Each of those things needs to be unpacked because they're actually quite complex.
Beyond this pregnancy and birthing, in general, the life expectancy in rural and regional areas is significantly lower than metropolitan areas. Where do you think or see the issues lying? Is it with the policy setting politicians, or is it the health administrators, or is it the lack of infrastructure, or is it funding, or is it something entirely different?
It's multifactorial, but I think the thing that I keep coming back to, especially as I do more First Nations health, is I think we need to make sure that we go back to the things that really matter. These patients or these First Nations people need to have a connection with their land that we have tethered. We've absolutely decimated the culture and the things that were so beautiful about Aboriginal and Torres Strait Islander health and their, what is part of their identity. We have removed their identity in many ways. We've, to remove them from country is to remove them from who they are. And that's huge. Like, I don't think anyone can actually comprehend that. Once you've removed someone's sense of self and their pride, you've actually removed their willingness to live. And so if I go to them and I say, you need to stop drinking, smoking, whatever it is, you need to have a career. who am I, like, to tell someone who doesn't know, doesn't have a sense of self, doesn't have a pride for who they are, to say you need to stop doing these things? It was white culture that brought those things to Aboriginal land, and I know a lot of what I'm saying is going to be very polarizing. A lot of people don't think that way, but if we've destroyed their sense of self, there is no way they are going to come back and stand on their 2 feet and say, this is what I need. We've actually caused such damage to their being that we need to work on that before we talk about any other infrastructure changes. The change needs to come from them, and it's once they heal, once a person is allowed to find who they are and where they've come from and their connection to country and to land and their culture and their heritage and where all of their value is. That is when they'll start to stand on their own 2 feet and say, this is what I need. And this is how I'm going to look after my health. That comes way before trying to improve the rates of rheumatic heart disease and chronic kidney disease are the things that I see disproportionately more than anywhere else. We need to make sure that these First Nations people are respected and heard and have a sense of self before we expect anything else.
You talked about we imposing conditions or, our expectations on the Aboriginal Australians. The biggest imposition is the close the gap. Like we are saying, you are here. The mainstream Australia is, the majority Australia is here. That's the gap. You need to reach here. You need to rise to meet that gap. That's the closing the gap. And we have been investing this for last 15 years. Dial hasn't moved. Right. So why is that investment not working? And what can we do to actually move that gap? Or is it again our mistake that we are imposing our benchmarks and our expectation on Aboriginal Australians? That close the gap is actually a wrong concept.
This is complex and I feel very unqualified to answer this, but I think, in some ways, the approach has been we are going to do this the white way, the white person way, the white fella way, and who knows if that's correct or not. In some ways, the policies and the funding that we are given for these programs, people get a tick box when they've spent the money, but we haven't actually looked at the outcomes. Is this actually working? Don't know, but we've spent the money. We did what we said we would do. But does it work or not? People aren't looking at the outcomes as much. And I think it's because it's difficult to look at the outcomes. You look at the outcomes and you go, that has done nothing. If anything, it's actually widened the gap. And people don't want to face that reality. People don't realize that actually making sure that they have adequate housing, that we give them, some of the treatment for the PTSD that they're enduring is far more important than being reactional. We're just waiting until, they develop their chronic kidney disease. We wait until, the domestic violence has happened. We wait until, they're incarcerated and, our prisons are full. That is reactional, and that's not the right way to do this, in my opinion. I think we need to make sure that we go back to the elders and we ask them what the issues are and what they think the solutions are, because it's not me who's going to have the answers, it's them.
And specifically to you, because you work in medicine, there is a expectation that Western medicine is the right way to go. And then in the Aboriginal way of thinking, our medicines, our way of thinking, the historical or ancient way of healing, that's much better. How do you balance those two things, that when, say, an Aboriginal patient comes in and they say, this is working, and in your training that this works? How do you manage those two competing, things?
I'm willing to listen, that we don't see the patients who don't come in, the ones who did have a abscess and it's actually healed with the bush medicine that they've tried. We don't see them. So we have a really skewed view of what works and what doesn't work. We don't see the ones who've managed to, use something herbal or something spiritual to heal themselves. And so that, I think, makes me very biased. I think it's important to have that humility to listen. If someone has said that they, are using this bush medicine, it worked, but now it isn't anymore, I need to work out why. Is that because there is a point where bush medicine gets you and then we can rely on the Western medicine? Do we use them together? Maybe in partnership we can get to a good destination. And so I think clinicians do need to reflect, and a lot of our leaders and politicians do need to reflect on whether our way is the correct way, because we have a very biased view of what that is. We don't see all of the healing and all of the amazing, miraculous things that they are able to achieve with something that's different to mine.
So you are in a very peculiar settings, right? Like, because you are in a health professional, which is already so draining. And then you have to deal with all these challenges of infrastructure not being there. And you're working with such diverse range of patients. And what if that patient is coming at 2 a.m. in the morning and you have to be called upon? How do you manage all that stress while you can't make mistakes in medicine? One mistake can be someone's life or death situation. So how do you manage all that challenge and pressure while still delivering the services?
Got to say, not very well, and I'm still learning. So I think, in some ways I've come to accept that I am going to be there, present, when someone is having the worst day of their life. That may mean that there are people that I will not be able to save, regardless of what I try. It might be that I make a mistake, or it might be that I'm there when something irreversible is happening. And, people do say the more medicine that you practice, the more errors you will see and the more badness you will see. It just is a measure of how experienced you are, not how incompetent you are. And so, in a way, I think that's how I deal with it. All I can do is do my best. And me not being there can only make this worse, I like to think. If I'm not there and I can't initiate any treatment and that patient is left to the cruelty of Mother Nature, it's probably going to be worse than if I had made that tiny error. I wake up every day wanting to do my best. And I like to think that, I train hard and my anxiety pushes me to work as hard as I can to do the best that I can for these patients. Conceptually and rationally, me being there shouldn't make things worse. And that's what I try to come back to.
You also do a lot of work for doctors' well-being in your own community. Can you tell something about that?
I think that's got to do a lot with, that's a nice tie into what we just spoke about. I think we forget that people who strive to be in high risk situations, so people who do strive to become, judges or, pilots or, people who work in very risky settings are usually people who are very hard on themselves. We are the type A personalities. We are going to, punish ourselves even before we've been sued or someone has reported us to the health, powers that be. We are going to flagellate ourselves every time something bad happens, worse than anyone else can. And we need to be aware of that. And I hope that, the general public can understand that as well. We are our own worst critics. And the more that we punish doctors, pilots, people who are in those jobs, the more you're going to lose them. You won't realize that, obstetrics and the issues that we're facing with women not getting enough access to the care that they need is directly related to how much we cast judgment on them. I sometimes find it really difficult to see some of the court cases and the things that have happened to colleagues, because they are my colleagues, that I know that they did their best. I know that they're not in this profession because they are trying to hurt people. But yet they're subjected to these very difficult processes when someone complains or someone sues, and they will only punish themselves for it. No one wakes up wanting to do a bad job. But we need to be mindful that those professions who are doing some of the most high risk, scariest things that you can face are human, and they will also have high standards for themselves. So we need to support them and we need to look after them if we want a society that functions.
You are in such a high stress environment, that type A environment, your family commitments, your work commitments, your regional commitments, your passion and emotional attachment to the patient and the other doctors. How do you yourself manage your mental health? Because it can be so stressing and anxiety driven, and it can snap someone so easily. How do you manage that?
Over time, you learn some of the signs that things are not going well. So it's actually my husband who's probably better at this than I am. So he will notice, he'll say, Marian, you're sleeping more than usual. Or, there's actually a ringtone on phones that I can never have again because I had it for 12 months and I'm so traumatized. Just the sound of that ringtone, it's almost like, those dogs in the experiment. My heart rate doubles and, I know that I'm stressing beyond rational. So being aware of the signs to say, I'm actually starting to lean towards burnout is really important. And learning about yourself and finding what it is that's important to you when you reach that. Sometimes I get to a point where I am just numb. I feel nothing. Something really devastating could be happening in front of me and I'm just numb. I feel nothing. And that's a warning sign. I know that when I start to snap at people, when I'm getting angry about things that usually I'm very tolerant of, that's a warning. And you need to be firm. Doctors find it really hard to take a day off. We feel guilty when we let the team down and we don't go to work. And I think we need to get better at actually building those things into the contracts to say, when you've had a bad outcome, when patient, that shouldn't have died has passed away and you were involved in their care, I automatically want to make sure that you take 2 days off and you do something that's going to build yourself back up. That's not optional. That's part of the standard. That is part of mental health first aid. We do first aid for burns. We do first aid for lots of other things, but we don't do it well for mental health. When something bad happens, when you have had a week where you've worked 80 hours, or when you have been up for 24 hours because you're dealing with really high risk things, it is automatic. Your fatigue management is automatic. You take 2 days off and you recover so that we can sustain this. Otherwise, you're not going to be able to last in this profession.
When someone is listening to your this talk and what you are going through in a daily life, and we already see that there are very few doctors, they're not coming into the profession. That's why we have to bring them from outside. Our health minister was in India, I think a year or two before, trying to bring in more nurses. So we're not even creating those nurses internally here. What, in that overall scenario that you're working in the settings that you're working in, how would you encourage more people to join as a health professional, be as a doctor, be as a midwife, be as a nurse, be as someone else, or paramedic?
I think I get a little bit philosophical when I'm asked this question. I think in many ways, I'm grateful to my parents for bringing me here, for giving me good opportunities to live, and I am living. I want to be able to look back on my life on my deathbed and say I've done something that I'm proud of. I have a legacy that's going to live long after I will. Yes, you can have children, and that's one way to do it, but I'm doing it in a way that's going to help our society, leaving the world better than when it was given to you and handing things back in a better condition. That's what drives me. It might not be what drives everyone. You do get paid a fair bit of incentive to be able to do the work that I do. So if money motivates you, there is money. But for me, it is that philanthropic need to make sure that I'm doing things that have made my life worthwhile. I was raised in a part of the world where I was told that I'm less worthy as a human. And so maybe that's philosophically why I've decided that I'm going to prove that wrong. But I know that I have more fulfillment when I have done a good job and I feel like I have helped someone. It might only be very small in a very small way, but that gives me purpose and it gives me meaning.
Let's give you an opportunity to build your legacy. You get one chance or make one change so that more people join the health profession, but also choose rural medicine. What's that change that you're going to bring in?
The hill that I have decided to die on, Nirmal, is I want to make sure that women in every postcode can access the birthing that they should, that they ought. It is a basic human right for a woman who needs help because she is pregnant and doesn't know what to do, or has had a very difficult home situation, but now there are children involved, and that always makes things more complex. I want to make sure that our society can be there for her, that we can support her. And the best way that I can do that is by going into this profession and learning the skills to be able to do that. My life is so fulfilled because I know that I'm doing that. And so I hope that others will learn that I want them to join this, not because I'm trying to win some sort of financial incentive. I want them to know that this is going into something that's going to be bigger than ourselves. This is so impactful and it's huge. It's something that shapes the world. And I want people to know that if we don't look after our mothers, we're not looking after anyone.
So, in short, I've like you've gone through your journey as a small kid that came from Egypt to Australia, to your whole journey to today. If you look back and you had to tell something to that little girl who started, what are you telling her?
I'll blow her mind. I don't think she'll believe that this actually happened. You know, when I was in, I'd finished my undergraduate degree and I finished the science degree. And I remember thinking, I'm quite religious. God, if there is just one thing, okay, maybe just two things that I hope that you will grant me. Please give me a partner that will support me for my whole life and support me for the crazy ambitions that I have. But if it's okay, please let me be a doctor too, because I know that I can make a big impact. And so I think if I was to talk to that little girl who grew up in a society where, it's not okay to have the faith that you have and you are less of a human because of it, I think she just wouldn't believe me. I would be explaining to her this dream that she didn't even have when she was young, but she's worthy and she's loved and she's valued. And that to me is what I would want her to know.
And when people see our conversation and all the conversations that you do across, say, in 50 years, how would you want people to remember you at that point? Like, this was Marian.
I don't really want people to remember me, to be honest, Nirmal. I think I just want the message to come across. There was once a medical student that asked me, Marian, how can you do the public speaking that you do? I get so nervous. I don't know that I can do that. And I said to them, it is not about me. It's about the message. If I'm standing in front of a room of politicians or leaders or, presidents of colleges, I don't care what they think of me. I'm the small ethnic woman who's, coming up with some sort of a message to talk to people about. But I am a voice for every rural mum who has had to drive hundreds of kilometres while she's in pain trying to deliver a baby, and the partner that is terrified in the car with her. I am her voice. I want them to hear that, and it doesn't matter who I am, it's the message. And that's what I want people to remember.
Wonderful. Thanks, Marian. It's such a positive note on all across. Thank you for the great work that you're doing. I don't think I'll be able to ever do that. I wanted to be in ONG, but maybe I think today, thankfully, I didn't go into that field. But again, thank you for all the great work that you're doing. And thank you for the time that you've given us to share your story.
And I want to say thank you to you, Nirmal. I think you're very humble that you're not sharing how much you do. For you to create a platform for people from different walks of life, different perspectives, and to create that platform for them, you're actually doing much bigger work than I ever will. So thank you.
All right. Thanks, Marian. Hopefully, we'll talk soon again.
Sounds good.